1, 2,
and review, female.
Oh shit, almost got some blood going. Oh, he's wearing it too.
You're in the bay. Once you get over to the bed, we'll give you the story. Everything's going to happen super fast. Welcome to the emergency room.
I lost the pulse.
It's
300 please.
I'll CCRN again.
Pulse check. No pulse.
no more pulse.
Yeah. Where the echo people get? And her blood pressure is also dropping.
45 minutes of CPR and no return of circulation. Okay.
Oh.
Okay.
Oh.
All right, guys. So here we are. We're at the end of the program. We are in critical care now. And this is the course that separates LVNs from RNs. All this stuff leading up to this point is what separated paramedics from RNs. So if you ask me, what it looks like is they took the RN scope of practice and they split it down the middle. All the critical care aspect of it went to the paramedics, and then all of the other nursing responsibilities went to the LVN or LPN, depending on where you are in the country or in the world for that matter. So here we are. We're at the critical care part of it. If you're a paramedic and you're transitioning to an RN, this right here is just going to be a refresher for you. For the LVN, you need to think critically, right? We're no longer dealing with, if you see your patient struggling to breathe, just elevating the head of the bed and slapping some O2 on via nasal cannula. Here, if you hear snoring respirations, prepare for RSI, etomidate, rock, whatever, and then you're going to tube them, okay? You're going to take their airway before they lose it, all right? So here in critical care, you're no longer thinking least invasive. You're kind of jumping to worst case scenario, all right? Especially in let's say a burn patient, if they got this massive burn, on their chest or something like that. As that skin starts to, heal and get taut and stretch, it's going to make it very difficult for the chest cavity to expand because it's like a rubber band holding that chest down. And so that's where you need to do that fasciotomy, and make that incision along the chest that give your lungs that ample room to expand. Because if not, you're going to quickly deteriorate into respiratory failure because you're not able to breathe appropriately because your burnt skin is quite literally, constricting your breathing. And so when you got a burn patient, and there are burns on their chest and everything like that, and you're starting to see them struggle to breathe, you need to start thinking fasciotomy, and you need to start thinking about taking their airway. Just stuff like that, okay? And so to round this podcast out and everything, I'm going to be uploading these episodes all week. Today, no book LM. I got as much as I could made. And then I reached my limit for today. I'll come back tomorrow and do the same thing. But I'm going to try to get all the material that I need for class uploaded this week because we start class on the 17th, which is next week, August 17th of 2026. And then after that, it's just going to be a sprint for about 4 months. It's going to be, for me personally, I'm going to have something every other day, nursing related every day, but I'm going to have some sort of deadline every other day. Tuesdays and Thursdays are going to be class days. Saturdays are clinical days. Sunday and Wednesday is going to be work. Monday is going to be for school. Friday, probably for school. So yeah, I really need to kind of get this up and running. And then on top of that, ACLS and PALS, my certifications are going to expire September and October. So sometime this week, I need to get those uploaded and I need to listen to those and I need to go and sit for my exam and mock code for those. So yeah, I got a very busy week ahead of me. But for you guys, listening to this, that may or may not be already done with the program or your particular nursing program. I've made this podcast in such a way that you can keep coming back to it, because I do have ACLS uploaded. I do have PALS uploaded. I will be getting TNCC uploaded. I know I've been saying it for about a year now, but I will get it uploaded. There is ATLS up there if you want to listen to that. Whenever I get my RN designation, I will be making NRP. I will be making episodes for your CEN. I will be making episodes for the TCRN because I'm going to be a trauma nurse. It's just what I love doing. So this isn't just for nursing school. There's also certifications that are going to be coming along with this. If there are certifications that you want me to upload to here, then by all means, email them to me at statstitch@gmail.com. Again, statstitch@gmail.com. statstitch@gmail.com. That right there is that way. If you're a rehab nurse and you want your rehab cert, up here, and that way you can listen to it, send it to me. I'll upload it. Or if you're in the ICU and you want your, I don't know, ICURN, I don't know what the hell you guys get, but go ahead, or your CCRN, I think is what it is. Go ahead, send it. I'll upload it. I know that sitting down and teaching yourself all of this stuff is very time consuming. And then sometimes it's written in such a way that it's very difficult to understand. So these AI hosts do a very good job of simplifying it and breaking it down Barney style for some of us. I know that a lot of us are practically teaching ourselves this stuff. So if you're going to be teaching yourself, this right here is another asset for you to use. But outside of that, man, we're rounding out this podcast as far as nursing school is concerned. If you guys want, I'll continue to kind of upload some crazy ER stories as they come in. Lately, I've been taking it low and slow at work just because of school and whatnot. So I haven't been getting as involved with the codes or as involved with the level ones, just because I've been trying to, keep up with the pace of school and whatnot. But of course, as soon as I get like a crazy case that just really kind of stands out, of course, I'll put it up here. But yeah, man, outside of that, this podcast has grown significantly. I'm very pleased with where it's at right now. We're currently about 7,000 listens, and I get about anywhere between 600 to 800 listens a month. That's crazy, if you ask me. And I'm expecting a huge surge in listens this semester because A, I guess it's typically when nursing school starts, and then B, I understand that not every country around the world requires the RN to have mental health as part of their curriculum, but I do have listeners from all around the world. All around the world: Korea, Japan, the UK, Spain, Portugal, Brazil, Chile, Argentina, South Africa, Nigeria, Egypt, Saudi Arabia, everywhere, man. This podcast is getting listened to all around the world, which is phenomenal. So, all right, guys. Again, this is the final season of the podcast. There's going to be a season for critical care meds, and then there's the critical care aspect that will be annotated as CC. And then, yeah, man, like I said, again, if you're in the hospital setting, if you're going to be working in the hospital setting and you need ACLS, you need PALS, you need NRP, you need all these different certifications just for your job, and you don't have time to kind of read the book and teach yourself, then come back over to the podcast and listen to ACLS, listen to PALS, listen to TNCC, listen to ATLS, listen to all these certifications that I've uploaded and made episodes on. That way it'll help you out, to be a better nurse and whatnot. But yeah, I wish you guys the very best. I made an episode about getting a nursing job. If you're a new grad RN, there's certain certifications that you need to stand out from the pack, and I've already listed them. If you get those and you show your potential hiring manager that you're really about this life and you're really about that ICU life or the ER life or whatever you want to do, showing them having that stuff already on your name, or on your resume is going to show them that you're really about it, and they're going to dedicate more time into you, at least for the second round of interviews, for sure. So, all right, man, I wish you guys the best of luck. Of course, like I said, as soon as I get some memory cleared on my phone from all the pictures that I've been taking of these books and stuff and uploading them to here, I will go ahead and upload the TNCC stuff. That way you'll have it. But in the meantime, ATLS is up there. So yeah, I wish you guys the very best. Thank you again for listening throughout this entire program.